I don't know what's going to happen. I don't know where the opportunities are coming. I don't know the next possibility. All I know is I'm not going to die here. All I know is my story doesn't end here. All I know is you may not like me, you may not give me the opportunities, but something better is going to happen. That's the attitude that I want to instill in you, that there is always better, depending on the choice you make now.
We are on the beautiful Cal Baptist University campus for the Health Professions Conference of 2018. The Health Professions Conference is an adult type of conference geared specifically to high school students to provide them the opportunity to hear from people in health careers who are coming in and speaking to them about their career and what it entails and kind of the path that they would take for students who are interested to get there.
They hear a keynote, and then they go to some breakout sessions. Then we have vendors here and lunch, and then they finish up the day with another inspirational keynote, and hopefully they all walk away completely inspired to go into the medical profession.
This actually allows them to attend sessions where they're going to learn about different types of health careers that are held by actual medical professionals. It allows them to listen to keynote speakers to hear different stories about them.
Well, students are not exposed to any kind of professional conferences, let alone in the healthcare, in the health industry. And my students, since they're anatomy and physiology students, most of the students are interested in the health field, but sometimes they don't know what's out there. So what they know is doctors, nurses, and that's about it. So having exposure to some of the associate programs, the certifications, as well as the pathways to get there, I think that's vital.
I think there's huge shortages in health field. For instance, when you look at primary care physicians in the Inland Empire, we have one of the shortest health fields in primary care. And one of the things that I want to do is essentially educate individuals, especially at the high school level, to start sparking some interest in primary care so that hopefully they can go on into college and into medical schools and choose professions in primary care, and hopefully they can come back and practice in the Inland Empire to fill these gaps that we have.
This is a good event for students to attend because a lot of times people think, oh, well, I want to get into to the medical field, but they don't really know of a lot of different health careers. They don't really know exactly what they want to get into. So this allows them to attend different sessions and listen to different speakers and attend the sessions that they think they're interested in. So that way they can get an idea of, oh, well, hey, I didn't know that this wasn't even a health career, but I'm very interested because of this session.
I remember growing up here in the U.S. And the experiences that I had going to the doctor was accompanying my mother and being the translator to the physicians that were taking care of her. She did not know any English. At that time I was still learning English, and I saw that there was really no connection between my mom and her doctor because he couldn't speak the language, because he couldn't really relate to her from her cultural practices. And so I found that there was big disparities between healthcare providers and their patients. And so the lack of biculturalism, bilingualism in the medical field was one of the precipitating reasons why I wanted to go into the field, was to help fill that gap.
My favorite part was definitely listening to the presentations, because I kind of could put myself in their shoes and I understood what they went through. And it kind of made me feel better about, well, I'm a senior and I'm going to college next year, so it made me feel better about what I should do in college and how I should kind of be determined to get to a higher position in my education.
It gets us more of an insight on different topics that we never really thought about, and like different places and different career choices. Like, I didn't know that there was other subsections of other things, so it's really interesting.
I think it's cool how we got together to like open up to different careers. Like, I didn't know there were so many careers within the hospital itself. And it's just basically how you get to learn more about the professions within the medical field.
I hope the students are inspired by speakers that they hear today, and they hear the personal messages of different occupations, and they go home and they work a little harder and make a plan for their life and think about coming back here and serving in the Inland Empire.
What I hope that the students take away from this is, first of all, the realization that they can do anything that they put their minds to, that all of these careers, all of these health career paths are available to them with good grades and with good studying. And so I hope they take away a little bit of inspiration, and also to have learned about a career that maybe they didn't know existed before.
I hope students really focus on what's next in their life. Take that a little bit more seriously. Not just what's next, but the series of next that leads to their ultimate place where they really want to be, what they want to succeed in, what they want to accomplish in life. That they would look at every step and focus on making the right choice or the best choice in that moment, whether they're in a good situation or a bad situation, how to make the